Welcome to the Insight series on personal well-being. Our question for this week is Wellness Big 10. What about medical self-care? Number 17. What about medical self-care? Our definition of medical self-care is as follows. The use of physician-derived information and knowledge to diagnose and treat yours and your family members' common self-limiting medical symptoms and conditions. Now, first, we need to become knowledgeable about your own body and your child's symptoms and responses to relevant circumstances. We need to learn to observe the precursors to those symptoms and determine what usually makes them worse and what makes them better. And these are what we consider the symptoms and precursors of medical problems. Now, according to the National Center for Health Statistics and the National Health Survey in the U.S., the average adult in the U.S. experiences, on average, two personal medical symptom events per month. That means 24 times a year, most of us as adults are trying to make sense out of what we're experiencing in terms of symptoms and precursors. So this is where medical self-care comes in, is to help us use physician-derived information rather than what we may have learned in our family of origin or what we read in a recent magazine, but it's to get better data and better source of information and references in making decisions about how to treat many of the symptoms that we experience as adults. Secondly, if you're going to be exercising this medical self-care skill, you need to learn to differentiate serious from minor symptoms for both children, if you are responsible for a child's health, and for adults. And particularly for your own symptoms, what really makes sense to you about your own experience with those symptoms. We want to use clinical or physician-derived information from authoritative sources. And some of those authoritative sources can actually be organizations like or websites like Medline Plus, that's the federal consumer health website, WebMD. The American Medical Association has a number of references and resources. The American Institute of Preventive Medicine provides many medical self-care books of different kinds. The Mayo Clinic has a major one, and there are a number of physician specialty websites and health plan websites that also can provide more authoritative, more science-based information about interpreting those symptoms. This type of information is usually available in a book form, pamphlets, sometimes websites, multifold documents that lay out a variety of insights, smartphone apps, and on telemedicine phone lines or telehealth phone lines. So it can be available in a variety of different avenues, different vehicles that we can use. The third issue in medical self-care is learning how to observe, measure, and describe basic health phenomena, such as body temperature, resting pulse rate, blood pressure, inflammation, breathing difficulties, pain categories, skin conditions, pupil dilation, lacerations, first aid, and assessing mental state. These are basic kinds of things. We're not talking about a full clinician knowledge, but we are talking about having some information which helps you sort and describe what it is that's going on in terms of those symptoms. Becoming particularly aware of common self-occurring or reoccurring symptoms and conditions is what we generally are trying to do in medical self-care. The fourth issue in medical self-care is determining what the main symptoms or main symptom is, and then using that information to consult the authoritative or physician-derived information sources you are using, such as those that we mentioned earlier. You can also read through the collateral questions that are oftentimes provided in those references and make comments and answer them as best you can to be able to help determine what the cause or the condition is likely to be that you're experiencing. And that's what we call the preliminary diagnoses. The fifth issue is continue reading what the sources suggest for either seeking additional medical advice or help. Sometimes we need to essentially go make a visit to our primary care practitioner, or in certain cases we might need to go to the emergency room. And to also help understand what home care diagnostic tests may be available from a local pharmacy, and that we may be available to have home care tips that can help reduce the discomfort, pain, or sleep problems that the symptom creates, and what there may be in terms of over-the-counter OTC medications that may be helpful. The sixth and last issue is we then want to monitor the symptom or the condition that we are observing in ourself or a family member fairly closely throughout the day and night, and be prepared to call your primary care practitioner. Now, all of us need a primary care practitioner. Usually that's a family physician or an internist. Sometimes it can be a naturopath, but it's someone that you trust and someone that can walk with you through your health journey. And then you may want to check with them about the appropriateness of the recommendations and the appropriateness of your decisions to deal with that specific symptom or condition. And that may be for yourself or for your child. So in summary, medical self-care, which these are some of the keys to that medical self-care skill, is a basic health literacy skill where we consult physician-derived information and knowledge to help diagnose and treat minor, common, self-limiting, usually medical symptoms and conditions. Now, for more information on this topic, try putting these terms into your web browser search engine: self-care or medical self-care, sources for medical self-care, resources for medical self-care. Now, in addition, if you use Amazon, you can go into their general search engine in your account, put in the term medical self-care references, and up will come a wide variety of books and resources for doing medical self-care. Most of the studies that have been done on the issue of whether clinical care is necessary or not, medically necessary, usually find that about a quarter of the health care that we deliver in the U.S. Through the $4.6 trillion of health care that's delivered to the U.S. population is considered to be clinically unnecessary. So what we're doing with medical self-care is we are essentially trying to reduce some of the unnecessary primary care, which is done in most of our communities and with most of our population. Next week, we will address the question, Wellness Big 10, what about preventing back pain? We encourage you to live well, live wise, live long.